no one is immune from opiate abuse. One of the highest uses of opiate abuse is in Sun City West or your major retirement centers. The reason being, so many people have had operations, they had knee replacements, they had shoulder replacements, and men been in the military. A lot of men that went to war, when they got out, they went to the VA and they started getting shots and what have you. And as a result of that, they got addicted. So no one is immune. You'd be surprised how many clergy that we work with that have been abusing opiates because they started out using it as a medical purpose, and it graduated from there. One husband and wife, they were both pastors, and they had an 18-year-old son. The son died from overdose of fentanyl. 6 months later, the father died from using prescription opiates. So the mother of the family, she lost her husband and her only son in a 6-month period of time. I can name a number of clergy across the state because our effort is statewide. How many clergy are addicted to opiates is astounding. So and since fentanyl has been injected into this situation, it's tripled in terms of people that are getting addicted to opiates for the simple reason, a lot of times folks, even in Sun City West, they will start using street drugs because it's a lot cheaper. So that's part of the whole cycle that we end up getting into. We're trying to break that, and that's why we're going to have to rely upon everyone in this room today and to spread the word for us. Our next speaker is Mrs. Maureen Rowland. She's an RN, RSN, Fred, put your glasses on, CSPI, and she's the managing director for Banner Poison and Drug Information Center. Maureen, your turn. Thank you.
Thanks, Fred. And thank you, Doug, for sharing your story too. At the Poison Center, we hear a lot of these stories, and I sit on the Fatality Review Committee for the state as well, and it's just devastating for families. So thank you for doing what you do and coming up here and sharing your story. It's very important. So again, my name is Maureen Rowland. I'm an RN, and CSPI is a certified specialist in poison information. So that's what that CSPI stands for. I've been with the Poison Center for about a dozen years. Before that, I was a pediatric nurse at Cardin Children's Hospital, and then I started my career in the neonatal intensive care unit at St. Joe's. So that's kind of my background. Kind of figure out how okay. And just, I have to say this, I have no disclosures, no conflicts of interest. So I'm gonna just briefly touch on poison control centers because I think a lot of people aren't really certain what we do there at the Poison Center, who works there, whatnot. There's 55 accredited poison centers throughout the United States. We have 2 here in Arizona. I'm the director at the Banner Poison and Drug Information Center, which is located at what used to be Good Sam, is now Banner University Medical Center, Phoenix, and so that's where the Poison Center is here. We cover all of Maricopa County. There's another poison center in Tucson at the University of Arizona College of Pharmacy. They're all pharmacists down there. They cover the surrounding counties. Just by volume, of course, Maricopa County, we do about 3/4 of the volume of the state for calls coming into the Poison Center. And we are primarily registered nurses. Every poison center also has a backup physician, toxicologist. So the specialty for poison centers is toxicology, which is pretty much everything. So anything that can poison you, whether it be medications, chemicals, envenomations, anything like that. So we always have a physician. Scorpions, yes, scorpion stings. We're in the midst of going into our peak volume for scorpion stings. So don't forget that poison center number if you get stung. So our physicians, not every poison center has an admitting service, but we luckily do here in Arizona. We have our physicians admit patients at Banner University Medical Center Phoenix, and then also at Phoenix Children's Hospital. And we deal with this opiate crisis daily. Daily we are admitting patients, daily. So it's I'll go into it a little bit more, but it's been a huge problem for a while, and like Fred was saying, COVID has really brought it to the forefront, because now not only are we dealing with the opiate crisis, we're dealing with a profound mental health crisis. So our suicide rates are going through the roof, with even pediatrics, again, the pediatric population, as young as 9 and 10 years old, we're seeing suicides. And it's increased just with calls that were notified at the Poison Center. We've had a 35% increase in pediatric suicides and suicide attempts. I already kind of went through that. So I think everyone's already kind of touched on this, but I'll just briefly discuss it. So opiates, in its natural form, and it's been here for a very, very long time, since back before 3400 BC. So it's the alkaloids in the plant that is the component that makes up your natural opiates. And you can see that kind of milky substance is coming out of that opiate, or the poppy. And that's where they get the natural form. Legally prescribed opiates, these are what we see, the prescription drugs where, again, prior to fentanyl, this is a lot what we were seeing with the abuse and the addiction that we were seeing. And then we have our illicit or illegal opiates. And again, prior to fentanyl, heroin was one of the big ones. We still have heroin. Heroin is still out there on the streets. It's just mixed with fentanyl now. So it's a much more potent. Like Doug was saying earlier, you're very unlikely to find anything on the streets right now that doesn't have fentanyl in it. We started seeing this really 2-3 years ago at the Poison Center when we were having somebody brought in by EMS that was abusing meth, and they were testing positive for fentanyl. So they're not even realizing that they're using a different drug or illicit drug. So this is just a visual so you can see we have a lot of fentanyl analogs, and so as Doug was referring to purchasing on the internet, really you look at more of like some of the black market internet, whatever, but what these, honestly, mostly if it comes from China, what they do is they look at that chemical structure and they just alter it slightly so that it can, they can sell it now on the internet or the website or whatever. So they're looking at those chemical structures, they're altering them slightly so that they can get around that legal system, and the FDA and the DEA. So they're constantly, and that's not just with fentanyl and fentanyl analogs, we're seeing that with some, I don't know if you've all heard of spice. Spice they can sell on the streets, you can sometimes get it. It's supposed to be like a marijuana with a little bit more of a jolt to it, and because of the way they just switch around those structures of it, they are allowed to sell it until the DEA catches up with them. So they, you can buy those at Circle K, So it's a really profitable market for these drug manufacturers to create these illicit substances, and it's terrifying. And this is just again a visual of the strength of fentanyl. So you see heroin there on the left, and then fentanyl just a few, a little bit less, a few grains, and then carfentanil is one of the strongest of the fentanyl analogs that we see, and we have had fatalities here in the state of Arizona with carfentanil. And that's typically, it's like supposed to be for elephants, as far as a tranquilizer for elephants, and so we're finding that here.
Is that Special K?
The Special K, no, that's not Special K, no, carfentanil, yeah. So what do they look like? This is where I say, so we have our natural prescription, then our street heroin, and then there's those M30s that we're talking about so much, those blue pills. We're seeing that everywhere throughout the United States now, but particularly here in Arizona because we have a pathway up from Mexico with these. And they're cheap. You can buy one of these pills for like $5. So they're very cheap. This is just a picture of one of the big busts we've had. I think when I did this put this slide in, it was about 2 years ago. I think we're seeing this now about every month or so that we're seeing this amount coming up through the border. And this is just a slide that shows, how so many people are dying from this. So we have non-professionals that are creating these fentanyl pills. They're basically just putting it in this big vat, mixing it up, and then they get that pill press. And you can see one tablet might have that 10 times fatal dose, and one tablet might not have anything. So you have these people going to parties, or you're taking down the street, you buy 5 pills, you take one, and you don't feel anything. So you're like, oh, I'm gonna take another one, and then that other one is the fatal dose. Or you could have even people splitting pills. We have some horrible stories of young kids, teenagers, 13, 14-year-olds splitting a pill and both dying. One pill, less than one pill, half a pill was killing them. So you can see how that can happen with this crude manufacturing. And they do have those they sell, you can buy online, anyone Google it. You can buy these pill imprints that make them look exactly like the prescription medication. We are doing a lot in the state of Arizona to try and help and prevent these deaths and these addictions. Anyone driving down to Tucson, this is a big sign, a big billboard on the way down. So again, like Doug was talking about, talk to your kids, talk to your kids, talk to your kids. And I'm gonna share resources at the end that have some toolkits and things like that give you some good verbiage to use. But I have 3 teenage boys, 14, 16, and 19, and I talk to them all the time about it. I show them when I'm putting together PowerPoints and slides, and I talk to them all the time. However, they still, this morning when I was leaving, my 14-year-old said, where are you going? And I said, oh, I'm gonna go do a Narcan training, naloxone training. And he's like, oh, what's that? And I'm like, how do you not remember what that is? I talk to you about this all the time. So you talk often, too. So it's not just having the one conversation, talk often to them about this. So what do opioids do? And again, Doug kind of touched briefly on this. So again, based on the chemical structure, it's affecting to certain receptors, opioid receptors within your body. And this is just a kind of a little slide to show where the main receptors are. So your brain, lungs, heart, spinal cord, and GI tract. And then to go on to the biggest part is with your lungs, causing you to stop breathing, essentially. So it slows down your respiratory rate, your breathing rate, and then eventually you stop breathing. So for naloxone or Narcan, and you'll hear people interchange it, so the generic name is naloxone, the trade name, and they're the only ones that make it, is Narcan. So it's the same thing. Naloxone and Narcan are the same thing. And it's a very wonderful drug that basically knocks off that opiate from those receptor sites. So getting the Narcan to the overdosing patient person immediately, as soon as you can, is extremely important and effective. IV is best. We have the intranasal. It's really safer for public to use the intranasal because when you're doing the IV or IM, you're dealing with needles and potentially risk to yourself. But that's what you're gonna see the paramedics who are responding, or in the hospital. We put people on naloxone infusions often because they've taken so much of an opiate. And that's the other point of this too. Once you've given it, the opiate that's in their system has a longer kinetics, longer half-life than the Narcan does. So just because you give somebody Narcan and might wake them up, there's a likelihood that they're still going to overdose. So it's imperative that you're getting them to help immediately. So 911 is that immediate call, and I'll kind of go through that process too. But the fact of the matter is just one dose of Narcan is not likely to continue to save them. So we often will have people leave, we call it AMA, in the emergency room. So they overdose, paramedics bring them in, they're in the emergency room, they've now woken up, they might have some withdrawal symptoms from this, and they say, I'm leaving, I'm out of here, and they go around the corner, and then they go down again. So the paramedics are kind of onto this now and usually watch out for them a little bit when they have somebody that's done that. So that's not an uncommon thing. So just kind of thinking about that it's not just a one-time deal. And the other thing too is that when you do give this Narcan, they often will vomit and go into that withdrawal. That's kind of one of the big misconceptions that people had when you look at like schools and who should have Narcan, and everyone thought, well, the main thought was, you know, if I give that to them, they're going to go into withdrawal and be violent, and you know, I need to worry about my safety. And the fact of the matter is usually they're just so sick that they're vomiting and feel horrible. Sometimes we can see some violence, but it's pretty rare, and that's usually like with by the time they're getting into the emergency room and whatnot. So again, that was kind of one of the big pushbacks when we started wanting to get naloxone or Narcan out into the community more, was that concern. But it's more of a concern for the actual individual that's overdosed, because aspiration is a huge risk. So how do you identify if they've overdosed or not? So again, my big thing that I'm going to push here too, so it might be somebody in your home. That's the most likely time that you might have to use this. But if you're, say, the church is one of those areas where you could potentially see this. This is a safe haven, so we do have people that are coming here. So first things first, make sure it's a safe scene. So you want to make sure if you see somebody that's lying on the ground, just make sure that you are feeling safe and comfortable to approach them. They're going to be unresponsive to touch sounds. They might have slow or shallow breathing, or you might hear some gurgling, some gurgling. And then they might have that pale look or blue nails. That's a good way to determine if they're oxygenating well. Limp body, slow or no heartbeat, and then very small pupils. And then this is just identifying an overdose versus a high. So when they're high, they're still responsive to you. They might have just slow speech. Here again, though, this is something where we've had some cases where if you have somebody in the home that you know is addicted and they might be high, so you're looking at these different symptoms here for the high, so they're still going to have a normal skin tone, but they have that slow speech. There is still potential that they are going to go into the overdose. So you don't want to be leaving somebody that's high alone either. This is somebody that needs to go into the emergency room. I think I need to go over this. So again, make sure the scene is safe. Then you can approach them. A sternal rub is one way to see if they're going to respond to you. That's just kind of a basic. If you've been trained in CPR, that's kind of one of the first things you do to see if they respond. And then if no stimulation, that's an emergency. If you're alone, call 911 first, okay? We need to get them into an emergency room, so you want to call 911. Tell them where you are, tell them what you see. Be specific as far as where you are too, if you can. So if you were at the church, you would tell them exactly where you are. And then if you have naloxone, this is when you're going to use it. And I'll just hold up if you got one after. I think you got this on. So everyone's going to be getting one of these. I'm not going to take it out of the package or not, but this is what it looks like. So you're going to peel off the back. And it does have, do these have instruction? No. These ones are 4 milligrams. So intranasal 4 milligrams, we typically start with a lot less if we're giving it IV. 4 milligrams, that might be enough, again, depending on the amount of, if it's a fentanyl overdose, how much is in their system. It might be enough to wake them up. You might have to give 2 or 3. I mean, we go up to sometimes even 20 milligrams. So each one is 4 milligrams, yes. So peel off the back, do not test it. It has that one dose, so I know it's hard because you see the little area where you can push it in and it's hard to resist that, but don't test it, please, because then that's your dose and it's gone. So this is just an indication of your finger placement. So you're just putting your fingers on either side. I'll hold it up again. Either side, and then just injecting it into their nose. Similar to like you would a nasal spray. So it's pretty much the same thing. So you're wanting to make sure that you don't have to shove it all the way back up there. You don't want to cause any trauma. Just good into their nasal passage, and then you just place your thumb on the plunger and push out. After you've administered the naloxone or Narcan, you want to make sure you put them into what we call a recovery position. Like I was talking about, they're probably going to vomit. So just prepare yourself for that and prepare them for that, because we don't want them to choke on that vomit. So you're putting them on their side. You can put, if you can put their hand under their head that will support it, and then you pull one of their legs over so that they don't roll over again. Again, we're just thinking about the vomiting, and we don't want them to go face first into that. If you know CPR and it's required, begin CPR. Or the rescue breathing, again, if they still have a heartbeat. So that's if you know this. You can, if you're on the phone with 911, you can put them on speaker, and you can put the phone down next to you, and they can talk you through how to do this as well. So again, that's probably gonna, if you have a loved one that's in your home, that's probably where you're gonna be wanting to do this, because again, of course, we're wanting to make sure that we're keeping you safe as well. This just again talks about the opiate withdrawal. So these are some of the symptoms you might see after you administer the Narcan. So it does put them into withdrawal because you're knocking that opiate receptor off of them. Toxic brain injury. So this is that last video that you were showing with the young man who overdosed, Aaron, who overdosed. His brain went without oxygen. So there's two different types. We have hypoxic brain injury and anoxic brain injury. So hypoxic is when your brain's not getting enough. So that's when you're approaching this overdosed person who's having that really slow breathing or gargling breathing. They're still getting some oxygen, it's just not enough. So they are starting to have some brain damage from that hypoxic. And then anoxic, they have no oxygen going to their brain at all. And within 4 to 5 minutes can cause irreversible damage and or death. And this is what we see with almost every overdose patient, is because of that vomiting, the aspiration, and they develop this pulmonary edema. So this is a common x-ray that we would see. Typically can present about 24 hours after the overdose. So here again, the response to somebody that's overdosed, it's not just giving that Narcan and they wake up and everything's great. There's a lot of things that can still happen. They can, again, still go down. They might need repeated administration of it, and then they can develop this pneumonia as well, which then could lead to the sepsis that we see. Doug already touched on this. You are protected. So not only can you purchase this, anyone can go and you can go into CVS and you can get it. One of the great things that we're trying to do within the hospital associations is anyone that comes into the hospital or leaves with a prescription for an opiate, they also get a prescription, or they also get the prescription for Narcan. So we're trying to tie those two together. Tina was talking about the opioid assistance and referral line. That's actually us. So again, we're 24/7. We answer those calls as well. So we're Poison Center, but we're also the opioid assistance and referral line. We manage that for the state as well. So it's 24/7. Our number is on those discharge orders with the naloxone as well. So anyone can call us at any time to either talk about their prescriptions if they're concerned, or we even get calls like, what is this? I don't even know what this is. They gave me this naloxone, Narcan, and why did they give this to me? What is it for? So again, not everyone knows about what it's used for. So we're happy though that more people are going home with it.
Can it be self-administered? Or would you be too?
You would probably be too out of it. So yeah, I mean, technically it could, but for somebody that's overdosed, yeah, they're not within the, yeah.
Just need to know.
Yeah. And I did have a little video too that just talked about the Good Samaritan law. I don't think it'll probably play, that's okay though. But the police, the law enforcement, they really encourage you to call immediately. Don't worry about any sort of ramification. That's what we're seeing a lot in the younger groups right now. There's a story, and I'll share the resource later, and it's a young boy that died from a fentanyl overdose. He just took one pill. I think it was a total of one pill. He took half, didn't feel the effect. He took the rest. And his friends waited an hour and a half before they got help because they were worried they were going to get in trouble. So that's one of the things I push hard when I go and I do talks in the high schools and things like that. I give resources to health teachers, and one of the biggest things is call immediately. You're not going to get in trouble. Call immediately, 911. These are just, we already talked about Arizona stats, but the Arizona Department of Health Services, AZDHS.gov, and then you can do a /opiate. This has, they update their dashboards weekly. So it has up-to-date statistics on Arizona, what we're seeing here, breaks it down by county, by age group.
Do they break it down by prescription versus street?
I don't think they do. I don't know that that's always, for a long time there, we couldn't even detect fentanyl. So, and even now, it's only certain labs that you can get it on. So that's where actually the poison centers, we started getting calls with fentanyl overdoses like 8-9 years ago. And they were coming in, and they like when I say they were coming in, they were being brought into the emergency room. We get the calls from the emergency room physicians that say with overdose patients, and they basically will call and they'll talk to me or one of the other nurses. They'll say, this is what they look like. So they have pinpoint pupils, they have a decreased respiratory rate, decreased heart rate. It looks like an opiate overdose, but the urine drug screen is negative. So we started seeing this a long time ago. You wouldn't be able to pick up that fentanyl unless you did a comprehensive urine drug screen, but that's not available everywhere, especially in some of the rural areas. Yes?
Is there a fine line, with your symptoms between fentanyl and just cardiac arrest? Because I was always thinking that people always have in mind fentanyl, dirty,
Yeah.
crazy, dirty.
Yeah.
People
Right.
dress real nice, they're just drugs.
Yeah.
And
Yeah.
so if you see somebody laying on the ground and you're going like, well, which one?
Yeah.
Especially if they're out of it. So can that Narcan actually cause?
It's safe, yes.
It's
Yes.
safe even with
Yes.
cardiac arrest?
So even if it was somebody that was not overdosed on drugs, and we're doing that pretty much EMS right now, that's coming on scene to anybody that's in cardiac arrest, or if they can't rule it out that it's a cardiac. They're giving Narcan. Just give it. And it doesn't matter if it's a kid either, because we're getting little kids that are getting into these, so we're having, it was just recently, we had like an 8-month-old that died from a fentanyl overdose. Because kids can get into things, especially at 8 months, and if you have a drug user at home and they have these fentanyl pills and they're putting everything in their mouth. But the fact of the matter is, though, too, is that you can give even young children fentanyl. It's not gonna hurt them, so you wanna give it to them. So it's definitely safe, and it's better to than not to. So again, this just has a good look at what we're seeing here. Most of the opiate overdoses are happening in personal residence, and then the next one is a public place. So again, churches, schools. So just something to think about. Take home points. Be ready. You guys will all get this. Make sure you have it with you. Don't leave it in the car though. So if you have it, keep it in your purse, or the heat. Living in Arizona, the heat, it's not very stable at 170 degrees that our cars get in the summer here. Remember to call 911. Make sure you're safe, but remember to call 911. Know your resources. So this is the Substance Abuse Coalition of Arizona, where you see that SACLAZ.org, and then /toolkit. It has so much information in there, a wealth of information, and it has some of the testimonial videos, It has links to resources, how to talk to kids, everything. It's really great. This was a grant that the state received, and they put together this coalition, and they really came out with some excellent information. Talk Now AZ is another excellent one. That's where that Vail board came from too. So they're doing a lot with just helping to get the community to talk about this problem more and recognize it. So these are just some of the resources, and that's it. Yes.